Pleasure to be here. Good morning, colleagues. Good to see familiar faces again. Good morning, good afternoon, good evening to those participating otherwise. And it was really quite refreshing to hear about Sir William Osler, because one of my professors when I was in medical school was a student of Osler, and so I heard about Osler all the time and I bought a number of his books. So it was quite great to hear about it and the importance of treating the person and not just the disease. So thank you so much. Now my slides are actually with you, so I'll be very happy if they put the slides up for me so I can begin the presentation. Wonderful. Okay, thank you so much. Let's move on to the next slide. And we're talking about the WHO Global Compact, Global Diabetes Compact, and the relevance to Brazil. Why should we focus on diabetes? We know it's a growing epidemic. There's a rise in global deaths, which have increased 70% since 2000. The premature death rate has also gone up 5% since 2010. And there's also an increase in the number of people diagnosed with diabetes. It's expected to increase from 420 million today globally to 570 million by 2030 if nothing is done to reduce this and turn back this trend. What are the drivers? Certainly obesity is a major driver, and that's increased 150% globally since the year 2000. Diets, physical inactivity are all drivers for this situation and responsible for 20% of premature mortality worldwide. We still have inadequate diagnosis and access to treatment. The majority of people with diabetes live in low and middle income countries, and they just don't have access to the necessary healthcare. Even though this year commemorates the 100th anniversary of the discovery of insulin by Banton and Bess at University of Toronto, 50 people with type 2 diabetes don't get the insulin that they need. Lack of access to primary health care. We talk about multidisciplinary approach to diabetes in care. It remains a concept and a construct for most health systems. It just does not exist. Health literacy is also lacking. Diabetes health services are not included in universal health coverage. And as we heard in some of the presentations before, the impact of COVID-19. What we've seen in our region is that as many as 50% of services for diabetes and diabetes complications have been impacted directly because of COVID. And the costs, of course, for managing diabetes are high. Next slide, please. This is a slide of the prevalence of diabetes in the Americas. 62 million people have diabetes. Overall regional prevalence is 8.3% and is highest in the Caribbean countries at 11.8%. It affects women more than men, and the rates are higher among indigenous populations. Brazil, which is the fifth from the bottom or so, has a prevalence rate of about 8.5% for diabetes. Let's go on to the next slide. Now, these are the diabetes trends in the Americas, and the actual global mandate in terms of the Global Action Plan has been that there should be no increase in diabetes or obesity. We can see from this slide quite clearly that the rates of diabetes continue to track upwards, so we will not achieve this global target. Next slide. Good. Now, what are the underpinnings? And I alluded to that before. Now, this slide shows the men in the green bars, the women in the red bars, and it does a comparison of all the 6 WHO regions. You'll notice there's some circles in orange with number 1. And those circles are the ranking of the region of the Americas. So the first number 1 is the prevalence of physical inactivity in adults. The region of the Americas is first. Then the other 3 ones, one under the other, are all about the prevalence of overweight and obesity in adults, the prevalence of obesity in adults, and the prevalence of obesity in adolescents. So we have the 2 drivers existing hand in hand, sedentarism and overweight and obesity. And these are the key drivers for the diabetes epidemic that we're seeing in the region of the Americas. Next slide. So in terms of the global diabetes compact, what is the vision? The vision is to reduce the risk of diabetes and to ensure that all people who are diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. And that speaks to the presentation we just had about the importance of those who are suffering. Let's go to the next slide. So that's the vision. Next slide. And this is the mission. Creating choices for countries in the face of complexity for diabetes prevention, early diagnosis, treatment, care and rehabilitation, whatever the development context, and to create the conditions for new ways for governments, UN organizations, civil society, philanthropic foundations, businesses, academic institutions, in other words, all the agencies, and most importantly, for people living with diabetes to power ahead together, faster and further than before in bringing diabetes care to all who need it. This is a whole of society, whole of government, whole of nation, whole of world effort to tackle and change the trajectory of diabetes. Next slide. So what are some of the objectives? To protect, to detect, to treat, and to recover. To protect means reducing major diabetes risk factors through policies and fiscal measures. To detect, which means improving the diagnosis and treatment of diabetes as part of primary health services and universal health coverage benefit packages. And as we know, many people have diabetes for several years before it's detected. It's at least 7 years that people remain undetected with diabetes in many societies. Treatment is important to scale up access to essential diabetes medicines, including, as I said before, instant, as well as technologies. So, if you're not able to measure your blood sugar and have glucometer access and so on, and even have insulin dispensing devices and syringes and so forth, the overall outcomes are not as good as they could be if the technologies and medications were available. And of course, recover, protecting people living with diabetes from COVID and vice versa, and building back better. Next slide. So what do you hope to achieve? In the protection, more people covered by at least one measure to reduce risk factors, dietary, etc., salt, sodium, sugars, increasing physical activity, improving tobacco control measures. And of course, in terms of detection, more people benefiting from affordable and affordable diagnostic tests for diabetes as part of primary health care. And of course, more people benefiting from diagnosis and treatment through universal health coverage. So that's on the detection. The expected outcome, so that more people will be who are diagnosed with type 1 diabetes will have access to insulin. More people diagnosed with type 2 diabetes will be managed by a blood glucose management protocol, which includes access to insulin for those who need it. And of course, more people screen for chronic complications and get the care they need. And as we know, diabetes is linked to neuropathies, retinopathies, et cetera, et cetera, et cetera. So a lot of morbidity linked to diabetes. And quite often, many health systems do not provide adequate screening, detection, and management. And then, of course, the recovery phase. There must be diabetes included in the domestic health response to COVID-19. And we're talking about a transformative recovery process that addresses inequalities, exclusion, and gaps in social protection. Let's go on to the next slide. And of course, as I said before, we are not doing very well in terms of reducing premature mortality from NCDs by a third by 2030, or in terms of covering all people with universal health coverage by 2030. So I spoke a little bit about the gaps in terms of the targets, and there's much work to do to achieve these existing targets. Let's go on to the next slide. So what is the health system response to diabetes in the Americas? We have to improve diagnosis of diabetes, treatment and self-care, as I said before. 20% of countries have specific plans for diabetes. 48% of countries have specific goals to reduce or control diabetes as part of their NCD plans. 74% of countries in our region have available medicine and supplies for diabetes. But clearly, access to many of these medicines and technologies remains a challenge. And I will highlight in this context the importance of the PAHO Strategic Fund, which allows procurement as well as technical cooperation, which makes medications available to countries at the best price through as they're selected through the WHO essential medicine list. But what we're seeing is, even though we offer affordable diabetes medicines and supplies, there's been very little uptake for these services in the region of the Americas, which is really quite a shame, because some areas, for example, HIV, have benefited tremendously. And I think really we have to capitalize. Next slide. Right. I wouldn't say much about nutrition and diabetes. Nutrition in Brazil. Brazil is an example of having the best dietary guidelines in the world. Let's go on to the next slide. And in terms of tobacco control, Brazil is a global champion. As you can see, the rates have gone down from 90% to 13% with all the various policies implemented. So they've done very, very well. Next slide. Good. We're on to HEARTS. What is HEARTS? HEARTS basically is a technical package that improves hypertension control in primary healthcare. So it's based on a team-based primary healthcare approach, patient-oriented. It uses evidence-based treatment protocols. It promotes healthy lifestyle, access to medicines, risk-based management, and referral, and systems for monitoring. And these are the pillars of HEARTS. It also contains new criterion for the diagnosis and management of type 2 diabetes, which is known as the HEARTS-D protocol. And so these, if we can implement these strategies successfully in primary healthcare, the evidence has been that you reduce mortality from cardiovascular disease. This has been shown to the Kaiser Permanente experience in North Carolina, in Northern California. Next slide. To date, HEARTS has been implemented in 12 countries of the Americas, and now Brazil, I understand, has signed on and will be joining this noble enterprise to strengthen the delivery of NCD management in primary healthcare. And we are quite sure this will make a tremendous improvement to the outcomes of the Brazilian population, coupled with what's already been achieved. Next slide. Next slide. Obviously, we won't leave anyone behind. Let's go on to the next slide. Next slide. Right, so there are a number of issues that, yes, thank you. The objectives that we need to do are to reduce childhood obesity, increase physical activity, reduce tobacco control, and pursue equity-based approaches. Next slide. And then clearly regarding detection and treatment of obesity and complications, we have to strengthen primary health care, manage the comorbidities. We have to build back better and strengthen universal health coverage, as well as expand access to care for diabetes management. Next slide. And this is all under the Global Diabetes Compact. Strengthening surveillance is also an important element of what we need to do, which includes surveys, digitalization, and strengthening registries, particularly for diabetes. Next slide. And of course, as you know, there's been a tremendous impact of COVID in Brazil. We've heard about it in details. I won't go into it in any great detail. Let's go on to the next slide. But certainly, what I will say is that some countries, particularly Mexico, has used HEARTS to strengthen their response and approach to NCDs in COVID. Next slide. So in conclusion, the diabetes prevalence and mortality continues to increase in the Americas. We need to improve the detection and control rates. The Global Diabetes Compact can accelerate improvements in diabetes care. We need to strengthen integrated management of diabetes and hypertension, which is part of HEARTS, in a primary healthcare system approach to achieve this. There are a number of tools, resources, and technical assistance available from PAHO and other partners, and the COVID pandemic has exacerbated the need for health systems strengthening and innovative strategies to manage NCDs, including diabetes. Thanks for your time.